بسم الله الرحمن الرحيم الحمد لله نستعينه ونستغفره ونعوذ بالله من شرور أنفسنا من يهده الله فلا مضل له ومن يضلله فلا هادي له ونشهد أن لا إله إلا الله ونشهد أن سيدنا مولانا محمدا عبده ورسوله صلى الله تعالى عليه وأصحابه وسلم تسليما كثيرا كثيرا أما بعد. السلام عليكم ورحمة الله وبركاته. This session, approximately 1.5 hours, is in essence going to be dealing with a number of different issues, specifically health, medical fiqh, the spiritual nature of fasting. Hopefully you can hear me well. Can everybody hear me okay? Okay. I'm assuming that everybody can hear me, and what I will do is I will therefore continue. Now, the aims of the session, in essence, are a multiple number of aims, but generally speaking, the first thing is to gain an understanding of the instructions from the Quran on fasting. That's a very important part of our iman in terms of how the kalam of Allah subhanahu wa ta'ala, the word of Allah subhanahu wa ta'ala, clearly give us some element of legislation in terms of how we deal with the subject of fasting. The second is to understand who fasting is not obligatory for and who are excused. And this is very, very important, especially when we look at the people around us who are unwell and so forth. Now, I'm assuming that many of you are from the medical background. Maybe there's a mixture of various others. And the idea behind this is to get a good gear in terms of understanding which kind of people are, in essence, obligated to fast. There'll be something briefly about dietary advice. I will also talk about understanding medical principles for safe fasting advice for patients. This is very useful for people from a medical background, for ulama, as well as anyone else who clearly has sort of individuals around them who are unwell, and clearly are excused from fasting. Then I will go on to the subject of learning the principles and how we apply these rules in specifically medical agents. So we call them al-wasi, the medical agents, and certain procedures that invalidate the fast. And finally, just to learn about the spiritual benefits of fasting. Now clearly, fasting has many different benefits. There are health benefits, which I'll outline shortly. And also there are some serious spiritual benefits. Allah subhanahu wa ta'ala very clearly outlines that we are trying to achieve the station of taqwa, as I will explain when we go through the slides. Okay, so let's begin with this particular slide. So these are the verses of the Holy Quran which are sarih. They are very clear. يا أيها الذين آمنوا كتب عليكم الصيام كما كتب على الذين من قبلكم لعلكم تتقون. O believers, fasting is prescribed for you, as it was prescribed for those before you, so that you may learn self-restraint, or you may find taqwa is translated in many different ways. But generally speaking, it's a state of spirituality, of closeness, of taqarrub, closeness to Allah subhanahu wa ta'ala, to that extent that you abstain, refrain from those things that displease Allah subhanahu wa ta'ala. Then further to this, then you will have the following verses, which are interesting. They follow on from this particular verse. أيام معدودات فمن كان منكم مريضا على سفر فعدة من أيام أخرى. So fasting the prescribed number of days, except if any of you is ill or on a journey, let him fast a similar number of days later. So clearly you will see that not has Allah subhanahu wa ta'ala only clearly outlined the obligatory nature of fasting, but clearly he has also outlined certain components within the ruling where certain individuals are excused, and namely the sense of being ill, unwell, and sick, and on also the issue related to travel as well. Then Allah subhanahu wa ta'ala further talks about وَعَلَى الَّذِينَ يُطِيقُونَ فِدْيَةٌ طَعَامُ مِسْكِينٍ. So what would be the compensation? The compensation here that you would have to get fidya, which is feeding one of the poor person for each misday. So I will talk and elaborate on the issue, more so on the issue related to those who become ill or who are not fit enough or who are frail to fast, and I will elaborate more on the principles around those particular individuals. Now, this is a continuation of the verse. So it talks about شهر رمضان الذي أنزل فيه القرآن هدى للناس وبينات من الهدى. So it is the month of Ramadan, and then in the same context of the verse again, it talks about وَمَنْ كَانَ مَرِيضًا عَلَى سَفَرٍ فَعِدَّةٌ مِنْ أَيَّامٍ أُخَرَ يُرِيدُ اللَّهُ بِكُمُ الْيُسْرَ وَلَا يُرِيدُ بِكُمُ الْعُسْرَ. So it talks about whoever is ill or on a journey shall fast a similar number of days later on. Allah intends your well-being, does not want to put you to hardship. So clearly, you will already see Allah subhanahu wa ta'ala has clearly outlined some really important principles already. The concept of ease and to reduce the issue of hardship during fasting. So there is an element of concession for certain individuals. Now, this gives a general outline of fasting through its obligatory on. So firstly, let's look at the concept of children. Clearly you'll find children of many different ages fasting, but generally speaking, as a sense of guidance, children under 12 years, or in essence children who are under the age of puberty. Puberty is obviously higher than 12 years in most instances, but generally speaking, 12 years would be a good cut-off point. It's an arbitrary point. Anybody below the age of 12 would be not considered as somebody who is obligated to fast. So if you have children who are going to school, who are clearly too young to fast or even to understand the concept of fasting, they are clearly excused. They are ma'soom. So on that basis, the kind of individuals that you'll find that tend to fast even below that age, so you may find some children do fast below that age, there is no issue in them fasting, but generally speaking we need to use a kind of a cut-off point or a line at which point we say that above this particular age then it's recommended that they fast. Clearly when they've reached the state of or the stage of bulugh, of puberty, of maturity, then at that time it becomes obligatory upon them. The other group of people are people who are incapable of fasting due to physical weakness. So there are patients who are acutely unwell. So it may be somebody who was previously well and as a result of a chest infection or become acutely unwell. Also, you may have somebody who may have been able to fast previously, but due to their frailty or their age and so forth, they are unable to fast maybe this year. So these are individuals who need to be taken into consideration. The other group of people are people with terminal disease, so terminal illnesses such as end-stage cancer, end-stage bronchitis, and various other things. Clearly, these kind of individuals, they are not obligated to fast. They have an excuse, they have a concession. Some of these individuals may be towards the end of life. And instances like this, these are generally chronic illnesses. So on that basis, the chances are that these individuals probably cannot fast during the winter months when the days are shorter. The reality is that in instances like that, where clearly you are unable to fast any other time of the year, then the idea is for them to pay a form of compensation, which we call fidya. The third group of people are individuals who have chronic disease. So somebody who has diabetes. Not all diabetics are necessarily within the group who would have the concession. So clearly somebody is taking oral hypoglycemic tablets for their diabetes and their diet is very well controlled and very fit, then reality is that they should really be fasting. Also, we have individuals who may have bronchitis or asthma or various other illnesses. And these individuals are in some instance excused from fasting depending on the severity of their illness. And we will talk a bit more about that later on. The next group of people we have are those who are mental illness. And sometimes mental illness can be a very taboo issue, especially in certain communities. Or even those individuals who are learning impaired, and we really need to gauge this in terms of understanding the impact of the cognition and the ability for somebody to understand the rulings of fasting, as well as recognizing the fact that some individuals, when they fast and they have a mental illness, they could, in essence, exacerbate their poor mental health. The next one is pregnant or breastfeeding mothers whose health or child's health will suffer from fasting. Now, as a general concession, pregnant women are exempt from fasting. That also includes breastfeeding mothers. Breastfeeding mothers, it would be mainly mothers who, in essence, solely breastfeed, and the child doesn't bottle feed as well. In those instances, then those kind of women are excluded, especially during this time of the year when the days are longer, and these women can be very dehydrated through the day, and their milk production is clearly decreased considerably, and that child is solely breastfed. Then we have pregnant women, and when we look at the concept of pregnant women, you'll find that certain women like to fast, but they would really need to take advice from a medical professional whether they are fit to fast. Usually you'll find that women who are in the early stages of pregnancy may decide to fast, and as time goes on, chances are that it becomes more of a burden, and in that instance, such women would be excused from fasting. Menstruating women or women with postpartum, so women on hay or nifas, clearly these are women who are in a certain state where they should not be fasting. And then there are also those who are traveling, musafir, and those who travel, they have the option of whether to fast or not. And if they feel that it would become too difficult for them, then they also have that level of concession as well. Okay. Now, just to briefly outline the general dietary advice when fasting. Now, some of you probably understand this even better than I, but there are a couple of important things that are worthwhile mentioning here when it comes to dietary advice and fasting, and more so recognizing the benefits of fasting as well, which is clearly evidenced in a number of research papers. Now, the first thing that we need to understand is that we tend to use up our blood glucose when we abstain from food, and as a result of this, if we were to abstain from food for approximately 8 hours, then this glucose reserve would be utilized, and the body starts breaking down the fats. So we go into the stage where we move from sugar usage or utility to fat, and then what will end up happening is the fat is used, and this clearly has certain benefits in terms of weight loss and so forth. Now, if we continued to fast, so if we were not to do iftar and clearly to break our fast during the evening time, then what would end up happening is in approximately 2 to 3 days, our body would actually start using up the protein within our muscle. And that sort of leads on to a process or a phase which we would call as an element of starvation. So clearly what will end up happening is we reach a stage of unhealthy situation where we are actually breaking down the muscle bulk and basically formulating our fuel from there. So the process from 8 hours and beyond, but yet not to the extreme of 2 to 3 days, is a kind of a detoxification process. And what tends to happen is toxins are stored in the body, in the fats, and these are then dissolved and removed from the body as a process of our fasting. Now, the other thing to really take from this is that you've probably heard of different types of diet. There's the 5-2 diet, which is called the fast diet also. And there was a particular medical doctor who was also a journalist called Michael Mosley, who basically presented this 5-2 diet, which in essence was evidence where you actually fast for 2 days of the week, and then 5 days you eat as normal. And there's been some very proven serious benefits in this, such as weight loss, reduction in the triglyceride levels, increasing in the LDL, which is low density lipoprotein, which is what we call cardioprotective, which protects the heart, and also a decrease in inflammatory markers like CRP and so forth. So there's obviously an inflammatory nature that is involved when we have high blood pressure and issues arise with in terms of the clogging of the arteries of our heart. So clearly, as a result of this, there's some evidence to suggest that when you do fast, and you fast in a very structured way, clearly with a balanced diet, then it has some very good health outcomes in terms of your heart and also your general vascular system. Now, this is something that's been taken from the Ramadan Health Guide, so if anybody wants to look at the greater level of detail in this, they can make reference to the Ramadan Health Guide, which is available for you to download. But generally speaking, here you will see that it emphasizes some useful points that are quite important in terms of having a balanced diet and ensuring that when we do fast, we don't, in essence, put on weight. And it'll be interesting that you'll find some people, when they fast, they actually end up putting on weight. And the reality is that you should really be losing weight. So clearly suggests that their diet is on one extreme. So some of the real issues that we have in terms of our diet when we do fast are issues such as deep fried foods. So we like our pakora, our samosa, so forth. So an alternative to that would be to emphasize food types such as chickpeas, potato and yogurt and various other spices, spice up the food slightly to give it some taste. And if you are to have samosa, you should bake it rather than to fry it. And these are some of the options that you can have. The other is about high sugar intake. We like Indian sweets, such as gulab jamun and so forth. And the idea is to really go for, if you are somebody who's quite clearly addicted to sweets, then to go for those sweet types that clearly have a lower sugar content. Then there's something about high-fat cooked foods. So, for example, paratha, oily curries, greasy pastries, and so forth. Now, the idea is to really emphasize food types which consist without oil, and to emphasize the idea of baking food, of grilling meat and chicken, rather than to fry these kind of food types. Cooking methods are very, very important. So deep frying is a red area. Clearly, we should try to avoid deep frying during Ramadan, rather focus on shallow frying. Yet the difference in taste, is very little, if any. Also, when it comes to frying, grilling or baking is healthier, as I mentioned earlier on, and avoiding curries with excessive oil. And the idea behind that is to sort of measure up your oil, very carefully reduce the content of oil that you put into your curries. So that's a general overview of the general diet that we should maintain during this great month of Ramadan. Now, this is a verse of the Holy Quran and a hadith, a prophetic tradition of the Prophet sallallahu alaihi wasallam. قُلُوا مِنْ طَيِّبَاتِ مَا رَزَقْنَاكُمْ وَلَا تَطَغَوْا فِيهِ. So Allah subhanahu wa ta'ala very clearly says, eat of the good and wholesome things that we have provided, but indulge in no excess. So don't indulge, don't go beyond what you normally do in terms of your general diet. Don't go beyond in indulging in such foods. So in essence, reality is that your food, sort of balance of your food during Ramadan should really be moderate in terms of the quantity, and also you should not overindulge. We tend to do this quite a lot because it becomes a very festive season as well. So Ramadan is a very festive season, and we like to celebrate iftar, and as a result of that, we like to spend a lot of time in the kitchen cooking or ordering food and indulging in this kind of food. And that really defeats the whole object of what Ramadan is trying to achieve. Ramadan is a form of moderation. It's not excess nor indulgence. You clearly refrained and restrained yourself and restrained the nafs through so many hours of the day, and then when we reach a certain time during iftar, then we begin to just ruin the whole concept of what we've done earlier on in the day. Now, we also have a hadith, and the hadith outlines a very, very important part of our mentality and our mindset in terms of how we observe this whole idea about fasting. So the Prophet ﷺ says, يقول ما منع آدمي وعاء شرا من بطن حسب الآدمي لقيمات يقمن صلبه فإن غلبة الآدمي نفسه فثلث للطعام وثلث للشراب وثلث للنفس. And what that really essence means that we should not fill our stomach. It's sufficient for a human being to eat a few mouthfuls to keep his spine straight. Now that isn't to say that we refrain from food as much as possible and eat the absolute minimum. In reality, it's enough for us to have sufficient energy to go about our daily activities and not to indulge more than that, not become extravagant in food. Very difficult to avoid in the kind of climate living we have. Food very accessible. There's the concept of fast food, which suggests that food can be presented in front of you within minutes, and clearly a very rich type of food. So the idea really is that we should eat in proportion, and we should ensure that when we do eat, we eat solely to relinquish our hunger, and not to relinquish our eyes in terms of the beauty they see in their food. So sometimes we eat with our eyes rather than our stomach. Just before I go on to the next slide regarding the principles for safe fasting, I noticed somebody's asked the question on sort of the kind of toxins that we are protected from. Now, there are certain toxins, I won't go into too much detail, that are basically stored within our fatty tissue. And these toxins are generally the byproducts of reactions in our body. And what tends to happen is, over time, they usually are released within the blood and then filtered by the kidneys, usually, or they are broken down in the liver. Now, when we tend to use the fatty sort of tissue in our body, what tends to happen is they are dissolved a lot sooner, and we are able to get rid of them a lot faster. Now, the other issues regarding principles for safe fasting, some general guidelines in terms of how you should systematically look at the process of what kind of individuals are usually excused. And generally speaking, a lot of this is just common sense. So, for example, when we look at the idea of simple issues such as people who've got asthma, frail elderly woman, for example, somebody who's got severe back pain, somebody who's suffering depression, and obviously the issue, especially today, related to GCSE exams and so forth, children who are sitting very important exams. So what's the issue related to this in terms of how we fast? Now, I'll open this out to you, and I'll be quiet for a short while. So I'll open these questions out to you. So just browse through this list, have a look at this list, and I will give you about a minute or so. I'm quite happy for you to ask questions regarding some of these individual cases of somebody who clearly has asthma or hay fever symptoms. What should they do? Are they exempt from fasting? When do they become exempt from fasting? Frail elderly woman. When would she become exempt from fasting? How do we define the concept of frailty? A young man with severe back pain. When do we say that the pain is not severe now, that we can clearly say that this individual is exempt from fasting? Somebody who's recently delivered and suffering from depression, something that doesn't always get picked up very easily, but somebody who's clearly having issues in terms of how they're coping. Now, when do we, what's our principle structured way of actually clearly identifying that this particular individual should ideally not be fasting? And then finally, the issue related to somebody who is sitting important exams, and we feel that fasting would be an issue for them. How do we sort of make decisions on these sort of instances? So I'll give you some chance to look at that, and a bit of time to have a look at some of those case scenarios. And Give me some kind of feedback in terms of how you would decide in any of these instances in terms of these individuals should not be fasting. I'm just reading some of the comments. So let's say, for example, let's start. We'll go through this in an orderly way. So we'll start with the first one. I've got quite a few questions here. We're going back to a number of slides actually with some of these questions. But somebody's asked the question regarding traveling, the length of travel. The reality is when we look at the concept of fasting and the concession that is laid out for those who are traveling, the main sort of theme here is to think of it as a state. So somebody who becomes a musafir, who is in a state of safar. Now, throughout that state of becoming a musafir, they are exempt from the process of fasting. So you could argue the case that when a person is a musafir, he may be traveling to a different sort of location, clearly quite some distance away, and in that particular location, you know, he's staying there for a number of days, and clearly, you know, he is able to fast. Then, in that instance, you would use your common sense, because you would look at the concept of, number one, the distance of travel, and you also look at the concept of the burden of travel. So clearly, if he's in a different location and he's not burdened, he's no longer actually in the process of traveling by vehicle, then really reality is he should be fasting in that instance. So that isn't normally excused. The excuse is usually in the process of burden during the process of fasting. The other question, it's quite a long statement as well as a question. Okay, I think I will answer some of these questions with the current sort of slide. So, anybody have any sort of view to how we would decide whether somebody who has asthma, for example, should not be fasting, or even a frail elderly woman? Okay, I'm just going to go down this list. Okay. Okay, well, let's just move on to the next slide, and then hopefully we'll have some kind of response to some of these questions. Now, I usually call it the four-principle approach, and what that really means is that when you look at somebody or observe someone who clearly is not well, now there is something about somebody not being well there, filhal, at that particular instance, at that moment. So, if somebody is clearly acutely unwell, so they have, for example, pneumonia, they have, they've just recently had a heart attack, and they're recovering from this illness. Now, in that particular circumstance, clearly what you would do is you would observe this particular individual and decide whether the person, as they are in the current state, whether they would be able to fast. And the measure for this, in essence, is their inability to physically or mentally perform normal and important daily chores. Now, how that becomes a measure is in terms of their ability to do their daily chores. So, for example, going to the bathroom, using the bathroom appropriately in the right manner, then also getting dressed, sort of carrying out their sort of daily activities through the house. If they have dependents, they're able to care for their dependents to some extent, to the minimum amount at least. At least those factors are sometimes taken into consideration here as well. Now, every individual has their own particular case, so if somebody has a complex case, clearly they would need to talk to a mufti or an alim or a scholar to get a more specific verdict on them as individuals. But generally speaking, as general overarching principles, the main thing to sort of look at is this concept of, number one, worsening physical health. So, for example, just to highlight some of these areas. So, for example, worsening physical condition. So, for example, if you generally somebody who has flu symptoms, and clearly if you were to fast, chances are you will become more dehydrated, and you would actually start suffering as a result of this. And then you can use your judgment to decide that if this individual did continue to fast through the day, their condition would worsen to the extent that they would actually enter this central circle. They will be unable to physically or mentally perform normal, important daily chores. The other thing is about slow recovery. So let's say somebody who is currently quite well, and they are recovering from an illness. So that maybe, for example, somebody who's had a recent heart attack, an MI, and they are clearly recovering from this process. And as they go through this recovery process, within the first few weeks at least, for them, fasting could be quite problematic, especially if they are likely to end up getting dehydrated. And if it will slow down their recovery process to the extent that they may end up in this stage where they are unable to physically or mentally perform normal important daily chores, then those kind of individuals would be exempt from fasting as well. Now we go down to this particular instance where we have worsening mental condition. So let's say, for example, somebody has depression, or somebody has schizophrenia even, or some kind of psychosis. So somebody who has depression, that would be an individual who clearly is in a state that their sort of mental state would exacerbate if they were to fast, on the basis that, again, it could be an issue of dehydration, it could be an issue of the stress in their system, dealing with the whole idea of fasting, and the stress that it comes to them exacerbates their symptoms of low mood to the extent that they become quite labile, very weak, unable to physically interact with the bigger world, again, having an impact on their daily chores, then they would be exempt as well. The last one, the worsening pain. This is somebody, a typical example of that would be somebody who, for example, has severe lower back pain. If somebody has severe lower back pain, now in those kind of individuals, chances are that they're able to function, they're able to do some of their daily chores, they're able to get around and do their daily things. However, there may be an instance where their pain has exacerbated to that extent that now it's become very, very painful. Now, individuals like these, one of the things that I would highly recommend is, especially issues related to pain, is to talk to your GP and try to get certain sort of pain relief that is more long acting, and that sometimes you can get sort of slow release medication that can relieve pain. And if that is not sufficient, then it's causing a lot of issues. You're quite immobile with this pain, and clearly as a result of that, you're unable to perform your physical and important daily chores. Then those instances, those individuals would be exempt. Sometimes the question arises that your general work could be an important daily chore as well. And reality is that when we look back at the books of fiqh, they make some reference to this as well. So, for example, it talks about a baker, and the baker, his source of income or his sole source of income is the earnings that he has from the work he does as a baker, and clearly he, struggles to fast whilst maintaining this role. In that instance, you can see that it falls within the concept of burura, of necessity. If he doesn't bake, he doesn't get his financial income, and if he doesn't get his financial income, he doesn't eat well, and that has an impact on his whole family. Clearly, in that particular instance, he would be exempt. But in today's society, sort of, especially in England, these things don't normally arise. So as a result of that, work would really not fall within the concept of an excuse not to fast. Somebody who may be unwell, who's at home, who's not going to work, but yet they're able to get about and do their normal daily chores around the house, though, those kind of individuals will in reality not be exempt. But generally speaking, we're looking at individuals who would really struggle through the day and even doing some of the most mundane tasks that they would normally do for self-care. Those kind of individuals will be exempt. Okay, let's just have a look at some more questions. Sorry. So somebody who didn't take their depression meds, would this count as a worsening their condition? Now, usually medication for depression is such that it's usually taken once a day, at the most twice a day. So I can't really think of an instance usually where somebody not taking their medication would be a problem because they don't have to take it during the fasting hours. However, clearly if somebody out of their own doing refrain from taking any form of medication for their mental health, so the reality is that they are not helping themselves, in that particular instance, it's not a necessity for them to take medication, even from the Islamic sort of point of view. Rather, they have that autonomy to make that decision, even from an Islamic perspective. Reality is that if their mental illness is likely to become exacerbated to the extent that they become dysfunctional, then in those instances, as a general rule, they would be exempt. So clearly, it may even be an issue of slow recovery. So mental illness could be an issue of slow recovery as well. So they could be going through a relapse phase, and clearly they're expected to take the medication. And if you fear that by fasting, their mental condition may worsen, and in fact, it may even improve. There are instances where some people who have mental illness or maybe depressed, they fast and actually spiritually they feel quite exuberated by this, and their health actually, mental health actually improves. I've seen instances like that. So it's a question of common sense, understanding the individual, gaining the right kind of advice from the medical professionals, and making that sort of appropriate decision. And you'll find that a lot of the time it is quite subjective. From the fiqh perspective, all it talks about in the kitabs is that you must approach what we call a tabib hadik. A tabib hadik is somebody who has the expertise, a doctor who has the expertise. Now, clearly, if we have somebody who has bronchitis and we go to a gynecologist and get their advice in terms of how we should deal with this, and clearly that gynecologist will not be considered as a tabib hadik. It would have to be somebody who clearly either deals with this individual patient as a doctor, or somebody who has the know-how and the understanding of this individual in terms of the medical, or has a certain level of expertise and understanding of the medical field to be able to give some kind of response in terms of whether this individual should be fasting or not. The other thing is, even though it does talk about in the fiqh kitabs that the doctor should be a Muslim, reality is that I would say in today's, using sort of in contextualizing that today, reality is that you probably find that non-Muslims sometimes are more sympathetic to the cause of fasting in terms of understanding that it's an obligation on you, and they will work with you to make an autonomous decision and give you the right kind of advice, probably more so than even some Muslim doctors. So reality is that you should really be looking for somebody who can give you the right kind of professional advice, has a good understanding of your illness, so that they can actually look at it from the perspective of whether you're the trajectory of your illness if you were to fast, and give a good probable account of what your condition could be as a result of this. I think that would suffice. It doesn't have to be a Muslim doctor. And I think sometimes I do get these calls from individuals who say, you're a Muslim doctor, so therefore, I need to come to you. But the reality is, I usually say, your own GP is sufficient. Now, clearly, if you find that your GP, is reluctant to allow you to fast for their lack of understanding related to the issue of fasting, then you're quite open to go to somebody else. We're not subject to just one or two medical professionals in how we make our decisions. Somebody's put the question: powder inhaler would break fast. Normal spray inhaler would not, if have to use every day. Now I'll come back to the issue related to those devices and procedures that break fast. I'll come back to that in a short while. Can you take Calpol melts or ibuprofen melts for pain when fasting? Now, interesting enough, if there's anything that would be sublingual, so something you would put under your tongue, that's not going to break your fast. However, if you were to swallow, that would, and I will talk about that in more detail later on. Now, the other thing about exams and poor concentration levels, we'll talk about that as we go to the next slide. Fasts are very long, as in the UK, and present. Can we shorten the fast to the length in Saudi Arabia? Reality is no, because we have what we call our mawaqit, our timings in terms of hulu and ghurub, the rising and the setting of the sun, and fasting is based on that basis. The time and the place, makan, where you are. So on that basis, you would have to go with the timings that you have. If you live in a country where they have no night or they have no day because of the timings of the hours and the concept of how the sun rises and descends in those kind of countries, you would go according to the nearest Muslim country or a country where you can clearly get some kind of indication in terms of their timings, and you would go along with those timings. But generally, as a general rule, you cannot take from the timings of a different country. There are ways, and we can see that many people, they have this kind of anxiety about the number of hours that they're fasting. The reality is that a lot of this is in the mind, and I will explain that in a short while as we go through this. So just a little query regarding non-Muslims. Could be quite quick in saying that you are ill and therefore you should not fast. Now, which is true. We do get that. I would say somebody who has a good grasp of. I'm a GP in Bradford, so clearly I work with the non-Muslim doctors here as well, and I find that some of them have a very good understanding in terms of patients and then their obligations to fast in Ramadan. Also realizing and appreciating that their great willingness to fast even when they're not too well. And you'll find that even in instances like that, you'll find some doctors will advise you that okay, you shouldn't really fast, but what I would advise you in this particular instance is that if you do fast, then this is how you should deal with it. So that's the general advice that you should really be really going with. Now, let's just move on to the next slide. One second. Oops. Okay. So going back to the issue related to people who are suffering from asthma and hay fever, just to highlight that issue, for those who consider inhalers as a means of breaking your fast, they basically nullify your fast, then clearly asthma would be very problematic for them. And in that particular instance, one good way of measuring somebody whether they are fit to fast is to actually measure their peak flows. So if you were to measure their peak flows, it's a little meter that you can get. They blow down this meter, they will see that if their readings are decreasing over time, and clearly you can get some kind of an estimate in terms of if they were to fast and get a bit dehydrated through the day, it could be problematic. So this is mainly for moderate or severe asthmatics. Generally, mild asthmatics, they can usually fast. It's not too much of a problem. There are some people who get quite severe hay fever as well, and they normally do need to use nasal spray. And you get those who have hay fever and asthma together. They have a sort of a strong immune response and they react to everything. Those kind of individuals, nasal sprays again, they ideally need to be avoided in Ramadan. And we'll talk about different sort of equipment and instruments different types of medication, what kind of things break the fast in a short while. But you get the idea that there are certain medications that can be taken once a day. There are certain medications. Nasal sprays can be taken twice a day. They can be taken once a day. So you need to basically go to your GP to get the appropriate nasal spray. Frail elderly women, or anybody who's frail, generally speaking, you would take it by the fact that if they were to fast, they become quite weak. If they were to get weak, they would not be able to do their normal daily chores, and as a result of that, they will be exempt from fasting. Young man with severe back pain, I've already talked about that. Really, if that pain is not severe, it prevents them mobilizing, doing their normal daily things. And clearly, the pain relief that they're getting is insufficient because of one, they're not taking it regularly because they're fasting. Two, the pain is so severe that even the pain relief they would be taking during the day would not suffice. Those kind of individuals would be exempt. And the woman recently delivering is suffering from depression. Again, you need to measure the level of depression. Clearly, if this lady is fasting and she is likely to have an exacerbation of her mental illness, then she would be exempt. A young boy sitting for GCSE exams. Reality is a lot of that is to do with preparation and planning. So a lot of these kids who are doing GCSEs, if they have the right kind of balanced diet, they eat the right kind of food, they're not having fast release sugars, for suhoor, sehri time, rather the right kind of diet with slow release carbohydrates at the right appropriate time. And usually it's a reasonable level of sleep, if you really plan their life well and their revision period well during Ramadan, at the time that they are actually taking GCSEs, you will not have major issues with this. And I think the other thing is about a lot of this is all in the head. So sometimes we have this mindset that, oh, I'm going to fast and therefore I'm going to feel weak, and I'm going to feel weak. I'm not going to be able to focus and concentrate properly. You'll hear even historically you have great sort of intellectual minds, and what they would do is they would actually fast for prolonged periods because they felt that they sharpened the mind. So you find contrary views in terms of how fasting can impact the mind in terms of your ability to think. So that's out to questioning. But the main thing to take from this is sitting GCSE exam is not an excuse not to fast. Now this is a screen that's worthwhile just looking at in terms of diabetes, and I know that some people do tend to ask a lot of questions related to diabetes. So this screen sort of highlights a couple of things related to diabetes. Before I go onto the screen, there's just a really useful question here. A couple of good questions here. A lot of questions here now flowing through. Outdoor construction workers in very hot countries such as Dubai exempt from fasting. Now, clearly, if the weather is such that a person is unable to work, so it's a very hot climate, they're outdoor, there are no other means of preventing that, and there is no way that that individual can take that time off work, and for a number of reasons, maybe because this is his only source of income, and it's the only way that he can provide food on the table. So therefore, in that particular instance, it's a question of necessity. So if this individual is really struggling maintaining his finances so that he can feed his family as a result of this, so that concept of darura, of necessity, as an individual, he needs to basically approach somebody who has the knowledge to be able to address this issue, and then in those instances, such individuals will be exempt from fasting. Another question about clove oil for wisdom tooth pain. We'll come back to that in a short while. Medication like benzodiazepine prescribed to a fasting person, which has similar mechanism like alcohol in the brain receptors. I think there is a difference between benzodiazepines and alcohol for two reasons. Number one is very clear in the Quran, it's sarih, very clearly, explicitly mentioned in the Quran. Khamr, alcohol, benzodiazepines are not explicitly mentioned in the Quran. It's not good enough to say that they have a similar kind of impact, because clearly they don't. Benzodiazepines can make you feel a bit drowsy. and it's usually the drowsiness effect that can sort of maybe sort of sharpen the mind. So on that basis, it's not really an issue taking benzodiazepines during the month of Ramadan, especially if it's helping you with your anxiety or your mental illness or whatever it is that you're taking it for. So I don't see the relationship between them. A Muslim patient in chronic pain requested rectal paracetamol as she intended to fast. This turned out to be quite expensive for the practice, and there was no clinical need to provide other stronger pain relief that could be delivered via a patch, for example. Yeah, so there is a question of expense and accessibility. So reality is, if you make a request to your GP, the GP was not able to give it to you, then clearly then there's an issue there. So you don't have access to that type of medication. So then we look at you as an individual. What is your current state? If you are weak, frail, as a result of your current state, then we go by that and decide whether you are exempt from fasting. Should we prescribe rectal paracetamol? Or the alternative would be the patient doesn't fast. Clearly, anything rectal, if it's a suppository, will break the fast. So on the basis of that, you shouldn't be prescribing rectal paracetamol. And there are a few other questions related to. Let's just go to this diabetes slide. I'm just conscious of the time. Now we have three groups of individuals who fall in this remit of diabetes. We have a very high risk, we have the high risk, and we have the moderate low risk. So very high risk, they must not fast, are type 1 diabetics, poorly controlled. Type 1 diabetics are completely insulin dependent. They're not producing their own insulin. They require insulin. We get those who have frequent hypoglycemic episodes. So those patients whose sugar clearly drops quite frequently, and when it does drop, they're not either hypo-aware, they're not aware that the sugar is dropping, and then suddenly they collapse. Those kind of individuals, or they need a lot of assistance when they become hypoglycemic, their sugar drops. Those kind of individuals would be exempt from fasting. DKA, diabetic ketoacidosis, very serious condition. Clearly, if somebody has had that in the past, or the near they will be exempt from fasting. And individuals who are diabetic will clearly have other serious medical conditions, such as heart disease and so forth. High risk would be type 1 diabetic who's got good control. So you'll find some type 1 diabetics who take insulin, who actually have good control, and they do fast. Ideally, they should not be fasting, but they do fast. And in those kind of individuals, if they are quite forceful on this issue of fasting, then you give them the right kind of advice. Type 2 diabetics who are poor control or on insulin, and you find type 2 diabetics who are basically have insulin resistance and not necessarily complete depletion of their insulin production. Those kind of individuals are at risk, and they should be advised not to fast, clearly because of their poor control. And maybe other additional illnesses that they may have. Those kind of individuals, you need to advise them not to fast, but if they do fast, then you need to give them the appropriate advice. If there are risk of hypos, not somebody who gets frequent hypos, but there are risk of hypos, then you need to advise those kind of individuals they should not really be fasting. Then you have the moderate to low risk. Okay, so you have type 2 diabetics, well controlled, quite clued up in terms of the diet control. Or type 2 diabetics are on basal insulin. Basal insulin is a long-acting insulin, kind of a background insulin, like Lantus, Levemir, and so forth, that they can take. And that usually is a kind of background insulin. There's a very low risk of them getting hypoglycemia, either blood sugars dropping. And those kind of individuals are usually quite well controlled. They can usually fast. Or somebody who's a type 2 diabetic, there's no history of hypos. Those individuals usually can fast as well. But again, you need to give them the appropriate advice and ensure that this individual is seeking health advice before they make that decision. So all patients must receive some kind of structured education, and they should be warned about hypoglycemia, and they should regularly check their blood sugar. So taking blood does not break your fast, so they should be taking, pricking their fingers and getting their regular blood glucose through the day to ensure that they have a good idea about whether they're getting a hypoglycemia and blood sugar is dropping or not. Other conditions would be things like, for example, respiratory conditions, moderate to severe bronchitis, emphysema, severe asthma, heart disease, severe coronary artery disease, uncontrolled hypertension, which is quite severe, high blood pressure, in other words, kidney issues, somebody who's having renal transplant, somebody even having hemodialysis should not really be fasting. Those who are immunocompromised, they're taking certain medication, such as steroids, because of their particular illness, whatever it may be. Chronic severe mental illness, that speaks for itself, and then acute illnesses. So, for example, somebody who's just had an acute exacerbation of their asthma, somebody who's had a nasty chest infection, somebody's having a severe flu, and they're not able to function properly. Okay. Now, just another exercise in terms of the things that invalidate or nullify our fast. What kind of things invalidate and nullify our fast? Now, there's a couple of things. I've made a list here of possible case scenarios. So a patient using an asthma inhaler, does that break their fast? Patient having a blood transfusion, does that break your fast? Patient taking insulin, does that make your fast void? So clearly injections. A woman using the vaginal pessary, an elderly gentleman using a urinary catheter. So clearly inserting a catheter in his urethra. So we'll talk about the principles behind this. So, like I said, as I talk through this, I'm sure that most of your questions will be addressed. So bear with me. If there are certain questions that you'd like to ask in addition to that, then fire away and ask me those questions. Now, just to understand this whole phenomenon in terms of the principles that we should look at and how we observe the whole idea of the things that make it fast, I've given you a kind of a visual diagram of the kind of things that you need to really think about. So, just looking from the perspective of the visual diagram, you'll see there is an opening into the body. Okay, be it any kind of opening, maybe an orifice, a natural opening, mouth, nostril, anal area, even the pores of your skin. Yeah. So you have a general opening. Now, the next stage is that you have what we call a passage. Okay, so this is your passage. See if I can get the right sort of tool to do this with. Just 1 second. Highlight. So you have a passage. Okay, we'll just use a pen. So this is a passage. Okay. So we have a passage, and this passage is this is called a manfasal mu'tabar, so a qualified passage. Then we have a cavity, and this is a qualified cavity, jawf al-mu'tabar, a qualified cavity. So for you to, the process that you have to undergo for it to nullify your fast should be such that the opening has to be clear as an opening which is qualified, and we'll talk about the opening in a short while. The qualified passage, or the manfasal mu'tabar, okay, has to be such a passage that qualifies a passage that leads to a cavity that would break your fast. So in other words, you have to have the right kind of agent. So it has to be a qualified agent. So let's say, for example, it's a morsel of food. Okay, it has to pass through a qualified passage. Okay, and it has to enter into a qualified cavity for you to break your fast. There are certain absolving states, and I'll talk about these are called the mawani', the absolving states, which are those things that even if this process was to happen, because of this particular state, it doesn't invalidate your fast. So for example, nisyan, forgetfulness. So clearly you forgot that you had fasted, and you walked into the kitchen and you had a glass of water. So clearly you've had water, it's passed through your qualified passage, entered your qualified cavity. and it should have broken your fast or nullified your fast. Because of the fact that you had forgotten, that would be an absorbing state. So you see there are a couple of things. Al-wasil, which is basically the qualified agent. And then you have the qualified passage opening, which is the munfasal mu'tabar, the jawful mu'tabar, the qualified cavity. And then there's a process, the process al-mawsul al-mu'tabar. Okay, the process of how this agent enters into the passage, into the qualified cavity, is another interesting point. I'll just briefly outline some of these interesting points so you have a good understanding. Just bear with me while I go back to my normal cursor. Okay. So here you have the qualified cavity, which we talked about earlier on. So you'll see that the fuqaha have clearly identified the qualified cavities. Remember, these are the cavities that if the agent passes through the passage into this qualified cavity, only then will it break the fast. So what is a qualified cavity? The stomach, the throat, and the throat would be, in essence, from anatomical sort of perspective, the pharynx. And so the pharynx right down the intestine, okay, right down to the rectum. And sort of being completely aware that the bottom end of the rectum or the anal area, you have skin, and then you have the mucosal lining which starts from the rectum. So it's the rectum that we're referring to. So in other words, your gastrointestinal tract from the pharynx right down to the rectum, all that would be considered as your qualified cavity. And you have called qualified aperture or the passage, the munfasal mu'tabar. So this is any orifice opening on the surface of the body, okay, be it natural or congenital. So even if you had a congenital passage, an aperture from your abdominal lining into your stomach, for example, that would still be considered as an orifice, okay? And it communicates with the qualified cavity. So it has to communicate. So the qualified passage has to communicate with the qualified cavity. That's quite important. So, for example, the mouth communicates with the esophagus, with the pharynx. The nose does. The ear, okay. The ear canals would only if the eardrum is not perforated. Okay. Sorry, if the eardrum is perforated. So the eardrum is perforated, then there would be some kind of communication between the outer ear into the eustachian canal down into the throat. So the other thing is the following are not considered applied as qualified apertures. So these are, for example, the lacrimal duct of the eye. Okay, and the reason why that is because there are certain hadith where kufal is used, that's antimony that's used in the eyes. Okay, and that would not break your fast in light of those hadith. For whatever wisdom that is, it may be because of the very minimal amount that actually enters the throat. Even though some people claim that when they put eye drops in their eyes, they can feel the taste in their mouth. But in light of a hadith which is transmitted, on that basis, that it would not qualify as something that breaks it if it was an eye drop. Qualified agents. So agents that rejuvenate the body, so food or medication, they would be clearly considered as qualified agents. Agents that are edible or non-edible. So it doesn't really matter whether they are food type. If you were to swallow lead, the back end of a pencil, swallow plastic, swallow a fly deliberately, those kind of instances would break your fast. Agents that are liquid or solid, doesn't really matter which state they're in. Agents that are soluble or insoluble, okay, and following do not invalidate. So air, clearly air is a natural thing around us, and we're taking and inhaling air all the time. Sensations of extremes of temperature, so if somebody was to put ice, for example, in their mouth, even though they should not be doing that, but let's say they were to put that in the mouth, and they feel the sensation of the cold near their throat, that would not break their fast. Whether it be the sensation of hot and cold. Or sometimes you could be in a climate where it's really hot and you can feel the warmth going down your throat, that would not break your fast. Then you have the qualified processes, which I talked about earlier on. According to the Hanafi school, the following conditions nullify the fast. So, for example, when you have an agent that enters the qualified cavity, the agent should disappear from view. Okay, so for example, let's take an example of a suppository. So if you were to insert a suppository anally, and clearly the suppository is visible from the anal area, that would not break your fast. It's only when it is inserted and is no longer visible, okay, that would break your fast. Okay. Another concept to take into consideration is there's a hypothetical case in the fiqh books related to if you were to have a piece of meat, attach a string to the piece of meat, and this is a hypothetical situation, and place this meat down the throat, down the gullet, into the stomach, and then you were to bring it, so it's like a hypothetical situation, if you were to then draw the meat out again, okay, clearly there's a string that's attached to the meat which is visible at all times, and it goes into the stomach, and you draw this meat out, and there have been no remnants, even though this case is impossible, there are no remnants of the meat in any form or manner in the stomach or the gullet or the throat. When you withdraw, then that would not actually break your fast. So let's take the example of a gastroscope or endoscope, a camera that is placed in the nasal cavity, into the throat, into the stomach, and then it's withdrawn again. Hypothetically, that would not break your fast. The issue with the camera or the scope is that they would use gel, and the gel will leave remnants in your stomach or your gullet, and that would break your fast. Then there are certain states which absorb the qualifying nature, so forgetfulness, nisyan, arduousness, okay. These are so things like fumes. You were to walk into this is called al-ghalba, okay, where you have fumes or vapor or dust in a situation, and because of the difficulty, mushaqqa, of avoiding them, you know, they enter your throat. So you walk into an environment where there's a lot of smoke. You should avoid those environments. If you're doing it deliberated, if it's a deliberated act, you're walking into environments solely with the purpose of inhaling these fumes. Okay, then if that was to be felt in your throat and go down your throat, that would break your fast. But if you were placed in this environment out of your control, if you were passing this environment without your knowing, or if there was some difficulty. So, for example, if you had a cold and you had mucus and you're accidentally swallowing mucus and so forth, and clearly we swallow saliva all the time, these kind of instances would be a form of exemption. They would not break your fast. The following are not excuse, so necessity. So you're very unwell, you must take a tablet or some kind of medication. Clearly that would break your fast. Ignorance, I didn't know that broke your fast, but later on we found out that it does break your fast. That will still break your fast. That will nullify your fast. Accidents, so even an accident, there's a difference between arduousness and accident. Accident, to some extent, is deliberated to some point. So, for example, if you were to gargle or use toothpaste and brush your teeth, and then you were to swallow the toothpaste as you were doing this, and that clearly would break your fast. Accidents would not qualify as something that doesn't break your fast. Coercion, ikrah. Okay, coercion. If somebody was to force food down your mouth, okay, that would break your fast. Sleep and unconsciousness. So even if you were in your sleep and somebody was to come and insert something in your mouth, and you were to swallow this in your sleep, then again that would also break your fast. Okay, so these are some of the issues when we talk about the absolving states. So let's go back to this particular slide again. Let's just point out a couple of things here before I go there. Just erase the diagram, the little points in the diagram. A couple of important points for you to take on board. One is the criteria that must be met for the fast to be invalidated. Right. Now, number one, there has to be a discernible, visible substance. Now, when you look at the inhalers, for example, if you were to use an aerosol inhaler and you were to, press the end, you'll find a vapor that will appear, and you'll see that the vapor is quite visible. It's a white vapor, it's visible. That would be something which is discernible. If that was to go into your throat and down your gullet, then questionably that would break your fast. I'll talk a bit about that later on in detail. The main point to take from this is that some people differ on this account. Some differ on the basis that the amount that goes down the gullet is negligible amount and therefore it doesn't break your fast. But reality is that if you measure the efficiency of inhalers, it's measured on the basis of the amount that enters the trachea relative to what enters the gullet. And no inhaler is 100% efficient. In fact, you're looking at 10 to 30% of it entering the throat into the gullet. So, reality is, my opinion is on this issue, and many ulama agree upon this, that inhalers do actually break the fast. There are certain ulama who basically sort of feel that the inhalers don't, and they do it on the basis that there's a negligible amount that goes into the gullet. The other thing is the substance reaches the digestive system. Okay, so it has to reach the throat, stomach, or intestine. The substance must enter from an entry point connected to the digestive system. So it must enter either through the mouth, nose, anus, or a deep abdominal injury. So you have an injury in your abdomen. If that injury communicates directly into your stomach. So, for example, peg tubes, feeding tubes that are inserted from the abdominal wall and they're inserted directly into the stomach. Those peg tubes, if anything was to pass through them, nutrition, whatever it may be, that will clearly break your fast as well. The substance has to gain an independent stay, so it has to move, it has to stay there, it cannot be withdrawn again, or there's no link to the external. No excuse is present, so none of those excuses are present, such as forgetfulness. So then, in those instances, your fast will be invalidated. This is a list of things that would nullify your fast and things that won't nullify your fast. So clearly, if you see a no, that means that they don't invalidate. But acupuncture doesn't. Okay, clearly there's no agent and there's no invalidating entry point. Creams, lotions, and deodorants don't. The pores of the skin are not considered as apertures qualified. They're not valid entry points. Gastrostomy and pegs, yes, they will do, because if you're going to pass nutritional food through these pegs, they have a clear invalidating sort of a passage that goes into a invalidating cavity. Okay, injections. Okay, this is an interesting point. So injections of fluids, be they intramuscular, subcutaneous, intradermal, intraosseous, and whichever way, that intraarticular, any of these methodologies will not invalidate the fast. Patches don't, again, it's through the pores of the skin. This is an interesting one, the ear, nose, throat, and eyes. Inhaler and nebulizers, you see there's a difference of opinion. But in those instances, my suggestion to you is, because there is such a difference of opinion, that if you are, if you can avoid inhalers, and I would avoid inhaler. If you are subject to using an inhaler, then you carry on fasting, but you make up for the fast. So you do qada in the winter month at a different time. Endoscopy, gastroscopies, they clearly would invalidate your fast because they use solutions sprayed into the throat, and the gel is used on the scalp. Lighting incense sticks generally would not break your fast. Okay, if clearly you are deliberating such an act and you're placing the incense really close to your nose, and you're deliberately inhaling this, and the incense is then felt down the throat, you can taste it in the back of your throat, then that would break your fast. So be very careful. Nose sprays, nasal sprays, these in essence, reality is that if they are just remaining within the nasal cavity and they don't go into the throat, they would not break your fast. But the thing is that a lot of these nasal sprays, they have a pressure system where clearly they spray quite far into the nasal cavity, into the throat. In that instance, they would break your fast. So be very, I would not use nasal sprays, I would avoid them altogether. Smelling food, perfume, there's no discernible body in smell and fragrance, so that would not break your fast. It's only when you taste it at the back of your throat. Okay. Smoking, there is a hadith in relation to certain women when they are cooking, and then they can taste the tip of the tongue, the salt content of their food and so forth. Generally speaking, that should be avoided. If somebody was to do that, reality is that they have an exemption in certain instances. However, ideally it should be avoided. Smoking, clearly smoking would go down the trachea and would go down your stomach. into your stomach as well, so that breaks your fast. And it's a discernible body. You can clearly see the smoke. Toothpaste, mouthwash, don't break your fast, but clearly you are taking a risk, so therefore you should avoid such things. Use a miswak or various other instruments instead. But generally speaking, if you were to use toothpaste and you can feel and you can taste the toothpaste in the throat area, and clearly you can feel it going down, that would suggest that you've broken your fast, you're invalidating the fast. Eardrops do not invalidate the fast. We talked about that earlier on. It's only when you have a ruptured tympanum, your eardrum is ruptured, it will break your fast. Eye drops don't break your fast. Placing something under the tongue, sublingual, GTM medication and things like that do not break your fast because they have not reached the throat. The other thing is the urogenital system. Okay, so you have, for example, the issue related to anal suppositories, examinations, colonoscopies, and so forth. They will break your fast because clearly they enter the rectum. That's an invalidating cavity. Also, sometimes you use gel and so forth. Now, vaginal or urethral examination. Now, the fuqaha in the early classical time, their belief was that the vagina and the urethra had a communicating passage to there was an aperture or form of communication between that and the intestinal tract. And for that reason, they therefore gave the verdict that they broke the fast. But we clearly know from our current understanding of the anatomy that the vagina is not connected to your intestine, nor is your urethra. On that basis, it will not invalidate the fast. So any kind of speculum examination should be avoided ideally, because the concept of exposing yourself in the month of Ramadan to that extent as well, and having a severe internal examination, any kind of internal examination should ideally be avoided, but because it's the element of risk. But vaginal examinations using pessaries in the vagina during fasting period do not invalidate the fast. Urethral catheters, cystoscopies do not break your fast either. That same thing applies there. Extracting blood or cupping does not break your fast. You're extracting something, you're not actually putting something into the system. Now, this is an interesting one. Nutritional IV fluids and blood transfusion. You'll find that certain ulama, they clearly say that these do not break the fast because they are in the vein, they go into the vein or they go to the arterial system. And for that reason, they do not invalidate the fast. Because it's not a qualified aperture or a passage, and it doesn't enter the qualified cavity. However, they are still forms of nutrition and they give the body strength. So my suggestion on this account is that you should avoid nutritional fluid, blood transfusion, anything along those lines during the fasting. To take blood is a separate issue because you are extracting blood, but to actually avoid any form of nutritional fluids or transfusion during fasting period because of the difference of opinion. Also on the basis that clearly it's a form of nutrition. However, if you were to have it and it was a real need, then it would not break your fast. However, you have certain ulama who say that it does. So maybe the way to deal with that is to actually make up for that fast in another time period. So dialysis, hemodialysis, peritoneal dialysis, same kind of issue again. It applies against the same point as I mentioned above. I know I'm going to be inundated with a number of questions. I think I've got a question here. The enemas clearly nullify the fast. If a person has an anal fissure and needs to use Vaseline on a daily basis to prevent the fissure from worsening, will that break the fast? Clearly, if the cream is just around the anal area and it's not being inserted into the rectum, so clearly some of those sort of anal creams or rectal creams would break the fast. So we use things like, for example, anisole for piles, hemorrhoids. Those would break the fast. The whole process of that is that they actually do enter and are absorbed in the lining of the rectal area or the rectal mucosa, so that would break the fast. If you were to place cream on the outside, just around the anal area, it should not break your fast. Okay, sort of very conscious of the time, and we've sort of reached time where we're nearly 1 o'clock. What I will do is I will briefly outline the spiritual benefits of fasting, and the way I've done this is a very sort of unconventional sort of way of dealing with this. I'll highlight it on in 2 slides. And what I will do is I'll make reference to Imam Ghazali, his concept and understanding about fasting. And this slide sort of defines 3 types of individuals who fast. There is what we call the ordinary person. So this is a Sawm al-Amum, the fasting of the ordinary person, somebody who is not clearly of a high spiritual nature. For them, what they would, the process they would undergo is they would abstain from food, abstain from drink and sexual intercourse. And you find that there are many individuals like this. They just abstain from food. They connect themselves with the masajid. They read the Quran and do various other things. But the main thing is that that's as far as it generally tends to go. So it's the minimum requirement to abstain from these things, and you find that a lot of people are usually within this particular category. Then you have the select few, or the Sawm al-Khusus, yeah? And Imam Ghazali explains that the select few are people who go beyond this. So clearly, the things of Sawm al-Amum are within their reaches. Also, they're abstaining from those things, and at the same time, they also refrain from unlawful gaze and not looking at those things that are unlawful. Unlawful speech, so backbiting, lying, swearing, talking lewdness, and various other things. So they would abstain from those kind of things. Unlawful music or tale-bearing, unlawful use of limbs. So, for example, stealing, using your limbs for the wrong sort of purpose, overindulging in food. So, also clearly eating an abundance of food, or eating around, we fall into that category as well. Overindulging in food to the extent that they're refraining from that kind of behavior. And in fact, what they do is they use these faculties, such as the gaze, the speech, and the limbs, and so forth, for good purposes. So, they talk good of people, they refrain from the gaze, they use their limbs for the right kind of things. Their limbs taken to the masjid, to the masajid. They read the Quran, those kind of things. So these are kind of a select few group of people. Then you have the elite and the Sawm al-Khusus al-Khusus. So these are the elite group of people, and they've reached a different kind of maqam. And they're sort of these group of people are those who refrain from that which leads to the other. So it's not just a question of them perpetrating these acts of unlawful gaze and unlawful speech and unlawful use of limbs and refraining from these things, but also refraining from those things that may lead to these things. So, for example, entering places where there's a risk of gaze, there's a risk of music and tale-bearing, or those kinds. So, for example, going into an open market, even they avoid those kind of places. There's a lot of deception going on in transactions. They avoid those kind of locations. They avoid going into open places where people indulge. So they avoid even going to restaurants to some extent. So these are, quite an elite group of people. So they have a high level of taqwa, not just in terms of refraining from those things that break their fast, but they live a kind of different kind of life. And they refrain from all worldly matters. So, in other words, when they talk Islam. So it's interesting how the last 10 days of Ramadan, when we do i'tikaf in the masjid, and we refrain from worldly things, and we are in seclusion, that's the kind of state of these individuals existing throughout the whole month of Ramadan, and not just solely i'tikaf. So their conversations are solely about Islam, their thoughts are about Islam, they talk very little. They refrain because talking too much, inevitably you're going to end up abusing or talking wrong. So on that basis, these are the elite group of people, and we should always work towards in that particular direction where we're moving from the ordinary to the elite. And there are certain spiritual benefits, and one of the things that fasting is such an important thing for us today, especially in the climate that we live in modern day society, where there are many things that really have a serious impact on us. And you'll see a number of spiritual benefits on a number of different websites and articles out there. So I'm going to avoid the detail, but get down to some of the really important issues that impact our iman, and then really make reference to the spiritual nature of Ramadan and how it has an impact on us. So, for example, materialism. Materialism, we're so heavily engrossed and indulged in materialism. And the thing about materialism is that it has a certain level of influence on us. We're unable to sometimes grasp the level of influence materialism has on us. So pleasure in material possessions, we take a lot of pleasure in them, more so because we are materialistic. And physical comforts, they become a very important part of our living. And we can't live without them in essence. And they become our goals. So let's say, for example, somebody who lives in UK, lives in a very comfortable home, has a wonderful bathroom, has a wonderful kitchen, has wonderful sofas that they can sit down and have, quite a pleasurable life. Yet you'll have somebody who lives in a third world country, lives in a shanty town, living in the most basic of environments. But yet you'll see that their emotional state in terms of their happiness, there's no comparison. Somebody who could be living in a quite sort of a really deprived, poverty-stricken area could be just as happy as somebody who lives in a quite sort of a kind of a rich environment where they live in luxury. So there is no direct connection in terms of happiness and the issue of the luxury and the material possessions that we have. It's a fallacy. So the other concept about materialism is our mindset and the way we think. So we start believing that nothing matter and its movements and modifications. And this is something that is sort of inculcated in our whole education system, our pedagogy, in terms of how education is delivered to us. It really embeds this deeply within our studies and the things that we study on a day-to-day basis. So clearly there are certain impacts of this. So if you look at the material possessions and physical comforts of our life, we like that the entertaining pleasure and not curbing it becomes an issue. So it makes one susceptible and vulnerable to social ills, which Islam considers immoral. So if we entertain pleasure more as a natural thing in us, then we are more susceptible, vulnerable to other pleasurable things, which fall in the remit of immoral, such as pornography, alcohol, adultery, and so forth. So it clearly has a spiritual impact on us. The other things are things like, for example, explaining the world through a reductionist viewpoint, materialistic and empirical sort of lens. We look at the concept of, we perceive the world as a cause and effect. But in reality, even when we look at doctors, reality is it's not truly the doctor that cures us, it's Allah subhanahu wa ta'ala who cures us. But yet we rely and depend on doctors, but they are just means, they are a sabab. They are not the actual origin of the shifa, of the cure. So our thinking is like that. Even though our belief is this, but the way we behave suggests that we are fallen into this whole cause and effect aspect of our life. So Ramadan benefits this in a number of ways because it moderates our physical comforts solely for pleasure of Allah subhanahu wa ta'ala. It embeds sense of self-control, restraint and patience in refraining from that which is religiously immoral. The other thing it does is it begins to see beyond the limitations of materialism and considers the spiritual nature of all things. So we see the spiritual nature of things. We start connecting more with Allah subhanahu wa ta'ala. We see that when we go to the doctor, it's Allah subhanahu wa ta'ala who cures us. When we relate to these things more. So it has an impact on our spiritual nature. Then the other things about individualism. So we have become very individualistic. So we have our interests of the individuals are or ought to be ethically paramount. Our individualistic sort of interests become sort of prima facie, sort of more weighted. So this promotes the exercise of one's goals and desires at the cost of other values. We give it more value. My own personal desire, my own personal interests become my priority beyond anything else. So what happens is personal preferences and self-gain are given priority. So this can cause issues, in terms of our marital cohesion. If you you're quite selfish in your way and your understanding it's only my way, no other way. So it can cause marital cohesion problems. It can cause issues in terms of authority and the right thing to do. It sort of denies the subject to personal gain and desire. You become disinterested in close family ties because there's a burden of family, who have demands on you, and rather your personal interests are more important to you. So you can see it does have secondary effects in terms of the way you live and how other people interact with you. But in Ramadan, there's a higher level of altruism and selflessness. So that we give more, there's more of a giving nature we have, we become more charitable. It promotes the concept of fraternity and closer ties with family. It affirms a sense of humility to the authority. And we become less about ourselves. It's more about others and valuing other people's feelings and giving. And then become, those are sort of, well, an embedded giving nature. So you can see clearly from this that, Ramadan has some very deep-rooted spiritual benefits, but sometimes where we don't always see. Yet, they become very sort of obvious in our daily activities. Okay, I'm just going to open up to questioning now. I've finished on that last slide. So I have a few minutes, so if anybody wants to ask specific questions related to some of the things, I'll go through some of the questions that have already been asked. Just bear with me a second. Okay, so placing oil on your skin. Okay, there's quite a few questions here. So I'll try to go through all of them.
Assalamu alaikum. Also, we had a hand raised earlier.
Okay.
If anybody wants to raise their hands now, we can unmute you. You can ask Dr. Rafaqat questions as well.
Okay.
Dr. Rafaqat, we have a hand raised. Amir Hamid.
Okay, just a second.
Can you hear me?
Yeah, I can hear you. Yeah. Okay, you have a question?
You've muted yourself again.
Yeah, regarding the inhalers, most ulama recognize the substance of the inhaler as is not a food, and that's why they categorize it as okay. It doesn't invalidate the fast. I know you might look at it as if it's a fume, like the fume of cigarette. Cigarette is not allowed, so that. But this is different. This is a necessity medicine for the substance for the person, and it's not a food particle. So that's why I'm asking.
Okay. So can I ask you a question? Are you in the belief that by taking pain relief and taking medication that would not break your fast, even if it was a tablet in tablet form?
Yeah, but the tablet form goes in the stomach, and that's different, isn't it? So that's a food. You have fulfilled the criteria, as you rightly said. It goes through the jaw, from the mouth to the jaw, and it disappears there. But that's no, and this is mainly go to the lung, and even if it goes part of it to the stomach, it's tiny and have no effect.
Yeah. I explained that earlier on, the issue related to inhalers. In essence, the difference of opinion is, yeah, clearly there are two things here. One is it of nutritional value, okay? And I think there is a quite serious unanimity in terms of things that enter the gullet would actually break the fast, because the gullet is considered as what we call a qualified cavity. So anything that enters the gullet would actually break the fast. The difference of opinion usually tends to mainly be emphasized on the point of the quantity rather than the issue of the agent itself. If you go clearly, even in some of the modern sort of contemporary fatwa that are out there, I'm talking specifically about some of the resolution committees, they talk mainly about the issue of the, number one, the quantity element. So they say there's a negligible amount that goes down the gullet anyway. And there's very few who really talk about the issue about it not being nutrition, because clearly there are certain medications that we would take, they could just go up to the gullet, and potentially we would say for that reason that they don't break your fast, and if you would follow that particular principle. So the main argument there is mainly the quantity of the medication that's going down the gullet. There is a difference of opinion. From my personal opinion, if you are somebody that clearly has to use the inhaler, then I would, like I said earlier on, I would recommend that you continue fasting. Don't consider your fast as broken or invalidated, but yet also on the basis of caution, ihtiyat, you can actually you make up for the qada. Okay, so we move on to the next question. Let's just move on to some of the other questions that are here. Just a second, let's go down to the list of questions. I had a whole list of questions here. Okay, 1 second. Right, okay, there we go. So I've got a whole list of questions. So what I will do is I'll just make reference to some of these questions, and then I will give a bit of a highlight regarding that. Okay, there's something about using oils for wisdom tooth pain. Is it possible to apply clove oil for wisdom tooth pain? Now, I'm not really sure about the procedure there, but generally speaking, I'm assuming that somebody's putting oil into their mouth for wisdom toothpaste, and maybe I'm wrong. But if for example, toothpaste, if you were to brush your teeth, for example, if you're brushing your teeth, that won't break your fast. That will not invalidate your fast. If you swallow the toothpaste, that will. So clearly, you need to act on caution. So you find that some people, even ulama, certain ulama, they act on caution more. So they ask you to avoid using toothpaste because you're putting yourself at risk. Others just basically clearly identify the fact that don't swallow the toothpaste. So as long as you get the understanding there. There's another question related to using patches. Okay, so a Muslim patient in chronic pain requesting rectal paracetamol. This turned out to be quite expensive. Yeah, so this is about accessibility to certain medication. You're asking your doctor to prescribe you something, in essence, prevents you from taking it throughout the day. A typical example of that is if you have a skin infection, for example, and you're given flucloxacillin. Flucloxacillin is basically something that you should be taking 4 times a day. Now, clearly, there's an issue there. Now, if that skin infection is bad enough that if you do not take this particular medication, you could put yourself at risk. It could spread, it could be a lot worse, and it could be quite damaging. And clearly, then in that case, you'd be exempted from taking from fasting. Then you would just take your antibiotic. But clearly, if it's an issue where there's a minimal infection, it's not causing a serious issue, then on that basis, you can ideally ask your doctor for something that would be less frequently taken. You could take a higher dose, so you could take 500 milligrams of flucloxacillin, but even then it's not going to have the same impact if it's taken 4 times a day. Having said that, it's better to take it 2 times a day than take it 4 times. It's better to take it 2 times a day than not to take it at all. So, but you need to discuss this with your health professional that this is what you're going to do. Let them give you some kind of advice in terms of how you should be taking this. Something about orthodontic attachments. Having dental procedure does not break your fast. So if you were to have your tooth extracted, that will not break your fast. At the most, you'll be taking sort of a mouthwash, and that would not break your fast because it doesn't reach the jaws. However, having said that, you're risking, you're taking a big risk. So on that basis, ideally you should avoid those kind of procedures during Ramadan. Yoga. In yogic philosophy, their method of fasting is to go on a wholly liquid diet with water for however long one intends to fast. And they feel that this leads to a high spiritual state. Okay, that's a long entry. Whether you believe such spiritual states can be achieved or are intended to be achieved in the Islamic model, and what you think of the yogic model. I can't say very much about the yogic model because I don't have a very thorough understanding about the subject of yoga. What I can say is Ramadan is a very spiritual moment, and it's a very important moment of connecting yourself with the taqarrub with Allah. The closeness to Allah subhanahu wa ta'ala is a very, very enhanced situation when it comes to Ramadan. You connect with the Holy Quran, to the kalam of Allah subhanahu wa ta'ala, and you spend time with the company of the righteous and the pious people. You connect yourself with the masajid more. and there you will meet some of the most pious people within your locality. You know, these things really do enhance your spiritual state. Avoiding food, avoiding water solely for the sake of Allah subhanahu wa ta'ala is a sense of sacrifice, and it truly is a real sacrifice, especially in the month of Ramadan, when Allah's mercy descends, and you know, there is a real sense of spirituality in terms of all this. So, you know, we don't need any other forms of spirituality. Ramadan is sufficient in itself. An enema, does it nullify the fast? Yes, it does. An enema is clearly the whole purpose of an enema is for it to be absorbed within the mucosal lining. So for that reason, it does break the fast. If a person has an anal fissure, and I've already answered that one. Insulin or B12 injections are okay. Yes, B12 injections are fine. They are basically injected into the sort of muscular tissue, so they're intramuscular. Insulin is injected into the fatty tissue, so these do not break your fast. Is it time the pharmaceutical industry invested in drugs, especially painkillers, which can be absorbed for those fasting so that we can continue fasting? Maybe that's something to think about. What about blood donation? Avoid blood donations during the month of Ramadan because you feel weak after donating your blood. So if you are donating during the hours of fasting, then I would highly recommend that you avoid it, because any kind of asbab which may lead to you breaking your fast, and means that will lead to you breaking your fast due to weakness, they should be avoided. So there is an element karaha, you know, of dislike in doing those kind of things. So I would avoid blood donation during that particular time. Having said that, blood donation in itself is not breaking fast. Okay. Clove, oil, things like that, placing things in the mouth. Be very careful, especially if they are nutritional. So clearly, if things are of a nutrition nature and you place them in your mouth, then you are taking a serious risk, because those things are inevitably that will enter the throat. You should avoid them at all costs. How come a gastroscopy can possibly not break fast, hypothetically not use an agent, but colonoscopy would? No, it's the same thing that applies. There's a confusion there. Gastroscopy and colonoscopies, any kind of endoscopy which clearly enters the gastrointestinal tract from the pharynx down to the rectum, will break your fast, not because of the instrumentation, but because of the gel that they use, and also they're using any certain sprays, anesthetic sprays, which enter the throat or enter the rectal area. So on that basis, colonoscopies do not break the fast alone, but because of the fact that they use agents and jellies and gels and so forth, that's the reason why it breaks. The pessary is visible around the anus and does not disappear into the rectum. The fast is valid, even though part of the pessary may reach the anal mucosa. The issue with the pessary is not necessarily the pessary container or the substance of the pessary, but rather the fact that the content of the pessary is absorbed into the mucosal lining. So when you place a pessary in there, there are remnants which go into the mucosal lining and are absorbed. That is what will break the fast, even though you can remove the pessary. Okay, so just to clarify on that point. Those who have unconscious seizures, should they be fasting, as well as those who have focal seizures, should they be fasting? I'm supposed to take tablets twice a day. Right now, can I only take one capra? You need to talk to your GP, your neurologist. If there's clearly an issue of you having seizures, now there are certain states such as stress to the body, through fasting, dehydration. These kind of things can actually result in you having an increased frequency of seizures. So you need to discuss that with your clinician or your GP and so forth, and especially if you're thinking about changing the mode of your administration of your medication. If you are due to have an endoscopy at 12 p.m., then are you meant to start the fast and then break, or not to start fast in the first place? Ideally, you should avoid endoscopies altogether in the month of Ramadan. You should make a certain effort to do that. If the endoscopy is done on the basis of an emergency, so clearly you've got in with some kind of bleed, or it's you've had a fast-track referral for a suspected cancer or something along those lines, and clearly you need to have that, then you'll be exempted from fasting on that particular day anyway. However, if you are clearly doing it as just an elective procedure, and you go in there knowing fully well you're going to have this procedure, and you break your fast, then that can be very troublesome, very problematic. So you need to be very careful. Having said that, if you were to have were to break the fast as a result of the endoscopy alone, then you would recompense that through qada. Okay, but if you were to think to yourself, oh, in that case, my fast is broken, I've had an endoscopy, and therefore I shall start eating, be very careful because then you have to do kafara. So a kafara is to fast continuously for 60 days. So you need to be very, very careful about consuming food after such a procedure. Okay. Using aerosol antiperspirant, will it break the fast? Using aerosol antiperspirants do not break the fast. It's not a deliberated act where you're inhaling, taking it into your mouth. And there's a pressure system in most of these inhalers. So if you were to get I would highly not advise you to do this, but if you were to get an aerosol antiperspirant and spray it down your throat, clearly that would break the fast. But other than that, it would not break the fast. If you're in an environment where there is clearly a lot of fragrance, it wouldn't break the fast. If you're deliberately going into an environment where there clearly is a lot of this vapor, which is very clearly visible, and you're deliberately inhaling this, and you can even feel it down your throat, going down your throat, then you're taking a serious risk in terms of it breaking your fast. Okay. Any more questions?
We have one hand raised.
Sorry?
Asma. We have a hand raised. Asma.
Okay, yeah. You can fire in. Ask the question.
You still have your question?
Assalamu alaikum, Ustad. The question, hopefully nobody will struggle with the Scottish accent. The question relates to patients that suffer from gum disease. I don't know if you've ever been in the masjid in the wudu khana, but a lot of the some Asian community, they suffer from gum disease, and you'll see that when they're cleaning their teeth during in halatus siyam and sawm, there you can see the blood, and when they're spitting it out. Now, I know that there's the Hanafi opinion of blood and saliva is that if the majority of the saliva has has blood and you swallow it, I think this is quoted in Fatawa Hindiya, then that breaks the fast. However, the other madahib, they kind of disagree. My question is twofold. One is, how do you measure? Because when blood mixes with saliva, instantly you'll have lots of blood inside your mouth. That was one question of how to measure the amount. And the second question was that if you are going to go on that Hanafi principle of it being ghalib in the saliva, then why does that not apply when it comes to the asthma? Because the research that you quoted was, up to 30% of the inhalers will enter the jawf, the al-jawf al-mu'tabar. Jazakumullah.
Okay, yeah, interesting. In terms of the perspective to having gum disease, and clearly you're having some kind of bleeding as a result of this, in essence, even from the Hanafi perspective, it clearly has to be such that you can actually taste the blood going into your throat, or you can clearly say that somebody's broken, invalidated their fast. Al-yaqinu la yazulu bi-shak is a principle that we use, that an element of certainty is not made void on the basis of doubt. So if it's just a sense of doubt, that's not good enough for it to invalidate your fast. You continue fasting. The concept of actually measuring the amount of blood to saliva content in your mouth, the only way that you really can do that is to spit and then see clearly if there's an element of a ghalba, there's a majority of the saliva that you spat is basically blood. That would suggest and clarify the point that what you have just swallowed and what you have tasted is clearly blood. So I think it needs to be looked at in terms of the context. Going back to the point regarding the inhaler, the point there is that we know clearly from evidential text that the content of the medication that is within the inhaler, which is very discernible and it's very obvious when you spray the inhaler, the vapor is very visible. That when you were to spray that to the back of your throat in a pressurized container, where clearly some amount of that will go down the esophagus, and in fact even reach to the extent of even go down into the top end of the stomach, maybe even, then we are very clear that that is something that happens. You know, there's no doubt about that. The question again goes back to the point that there's no such a concept of doubt here. There is an element of certainty. No inhaler is 100% efficient. So on that basis, you know, there's no issue of shak here. You know, it's yaqeen, and you know, you're getting some of that vapor entering into your gullet. And there's some fuqaha basically go on the point that because it clearly is medication, regardless of being nutrition or not nutrition, it's medication. It qualifies as being what we call al-wasil, an agent that invalidates the fast. And on that basis, they will say this. Going back to the point that the other brother mentioned earlier on, that it's not nutrition, therefore there's an issue there. Even if you were to look at the text from the Hanafis, I'm being very I'll go into a bit more detail in terms of the bit. But generally speaking, from the perspective of the agent, al-wasil, that invalidates the fast, the Hanafis and the Malikis are very clear that any kind of agent, regardless of whether it's something which is edible, it's nutritional or not nutritional, even if it's to be plastic or even some kind of vapor, which is discernible, if it enters the jawf al-mu'tabar, the cavity, then that will clearly invalidate the fast. The difference of opinion lies with the Shafi'i and the Hanbali. Okay, and they basically, the Shafi'i, there's a number of ulama amongst the Shafi'i fiqh which vary in their opinion. Some basically feel that it has to be of nutritional value for it to actually break the fast, but that's the lesser opinion. Rajih of the Shafi'i, even then, is that even if it's not of nutritional value, it will break the fast. And the Hanbali is the same. So that's probably where sometimes if you go to resolution committees, where you find the majority of the scholars there who follow the Hanbali madhab, they may come to that conclusion. And that's where the difference generally tends to lie. However, like I said, I'm being very open to this, and that's why, for that reason, I have clearly stated that due to the difference of opinion, there are certain areas that are not clear, and on those points, you should continue to fast, you know, with that mindset that I am fasting. However, if there is any element of doubt, then we should also make up for the other. There's no harm in making up for the fast at another time. Okay, inshallah. Hopefully that answers the question. I'm assuming that that's the last of the questions, and I will pass it on to the organizers, inshallah. Jazakumullah khair. It's been good to share my knowledge with yourself and also to gain knowledge from yourselves also. May Allah subhanahu wa ta'ala place a lot of barakah and truly make our Ramadan a real element of spiritual benefit for our life in the dunya and in the akhirah. Subhana rabbika rabbil izzati amma yasifun wa salamun ala al-mursaleen walhamdulillahi rabbil alamin.